It is not just about being punched or kicked or hit. It is a system of power and control over another individual.
Oftentimes we put a lot of pressure on the victim of domestic or sexual assault. We ask different questions like, well, why don't they just leave, or why did they drink too much? But I think we should really be putting the pressure on the perpetrator and just to be asking the simple question, why are you abusing?
And that it can be anything. It can be financial, it can be physical, emotional, anything like that.
So in 1979, a woman named Edith Palmer gathered with a few of her friends to discuss the issue of women who were being battered in their significant relationships. From this recognition and their refusal to look away, New Hope was born.
So advocacy at New Hope, we are providing immediate short-term crisis intervention support to survivors. And we can do that in a variety of settings. We can do that in our offices, but we can also do that in the hospital setting, police stations, and also the courthouses. So an advocacy session in the New Hope office can look like a variety of different things. We can provide a client access to some practical things that they might need. It could be a fax machine, could be a copy machine. Really, ultimately what we're doing is providing somebody a safe place to have a conversation about options.
The courthouse can be a very intimidating place to be, and we are there to help survivors through the ins and outs of obtaining a restraining order or a harassment order. We walk them through the paperwork. We will go into the courtroom with them and be there for moral support. We will talk to them about resources, whatever they might need. We might refer to our agency for shelter or financial assistance or counseling, whatever they might need.
The New Hope Shelter program is aimed at giving individuals self-sufficiency out in the community in the safest way possible. New Hope has 2 confidential shelters, one in the South Central region of Massachusetts and one in the Southeast region. Each house houses about 6 families or individuals. You know, our shelters are only so big and there's only so many, and we get thousands of calls, weekly for people looking for shelter.
The New Hope Counseling Program offers short-term supportive counseling services to children, adolescents, as well as adults. And we offer that in both group and individual format. And we also offer services for survivors' family members. So any significant other friend or family member that's been impacted by the violence as well can also receive services through New Hope. I think one of the really important things about counseling services at New Hope is that the survivors that are coming in are going to get a non-judgmental experience. I think people that are working through trauma can often feel judged, maybe by friends and family who mean well, but sometimes ask questions that can feel a little bit like maybe they've put some pressure on the survivor. And one of the wonderful things about New Hope is that's not going to happen here. You're not going to sit with a counselor who's going to say, you should have done this, or why did you do that? You're going to be sitting with somebody that really understands how this works.
So at the MJ Leadenham Center, we offer supervised visitation, we offer monitored visits, and we offer safe exchanges. So supervised visitation is where a staff member sits with the children and the parent for the entirety of the visit, just to obviously be one-to-one with the child and parent the entire time. Monitored visitation is a little less restrictive, but again, it provides that safety. It's where the staff member will check on the visitation. They'll still utilize our center, but they'll check on the visit maybe every 10 to 15 minutes, and we'll be able to supervise if necessary. And then we have safe exchanges, where the children are allowed to have outside of the center contact with their parent, where 4 hours in the community or community access. But there's a restraining order between the custodial parent and the non-custodial parent, for example. So we provide a safe exchange where the parents don't have to have contact, but the children can easily go from one parent to the next to prevent any potential conflict.
Primary prevention means going out into the community, talking to schools, different organizations about how to keep yourself safe, what to be aware of, how to be a bystander, how to do it in a safe way, and keep yourself safe while also helping others stay safe as well. Our healthy relationship groups are with students in high schools. We go and we talk about different warning signs to be aware of and what it means to have a healthy relationship so that they are free of violence in the future.
So the Respect Batter Intervention Program is certified by the Massachusetts Department of Public Health. It's a 40-week program for individuals who are referred to our program, typically through district courts within the state of Massachusetts. It's a rehabilitation program or a psychoeducational program. So our job within the program is to teach the individuals referred to our program about their unhealthy belief systems and how they've affected their relationships.
I do this work because I genuinely believe that survivors can heal from trauma. And I genuinely think that people are capable of having a life past violence.
Everyone deserves to have a life free of violence.
You know, I think that we're all a product of our environment, and I think that individuals have the ability to change, to better themselves, to better their relationships, to better their future, to better their children.
I do this work for my family, for my mom, for everybody else's mom and everybody else's family.
I do this work because we need to help each other.